Pleasant afternoon, everyone. Today, my group members and I will be introducing to you four essential imaging techniques used in modern medicine. These include echocardiography, CT angiography, MRI angiography, and cardiac catheterization. Each of these methods help doctors visualize and assess the heart, blood vessels, and surrounding structure, playing a crucial role in diagnosing and treating cardiovascular conditions. Through this presentation, we will explore how each technique works, its benefits, as well as the unique limitations of each. By the end, we hope to give you a clearer understanding of how these imaging techniques contribute to better diagnosis and patient care.
Echocardiography. Echocardiography is a non-invasive imaging technique used extensively to evaluate cardiac structures and function. Multiple echocardiographic techniques exist, including transthoracic echocardiography, transesophageal echocardiography, stress and three-dimensional echocardiography. TTE, transthoracic echocardiography. Indications. Most common echocardiographic technique for initial evaluation of suspected heart disease, used for conditions such as valvular heart disease, cardiomyopathy, and heart failure. Assesses left ventricular function and detects pericardial effusion. Benefits. It's non-invasive, widely available, can be performed at the bedside, making it suitable for a broad range of patients. Provides real-time images useful for assessing the heart chamber sizes, ventricular function, and valvular abnormalities. The limitations. It depends on the acoustic windows, which may be suboptimal in patients with obesity or lung disease. Image quality can be affected by unusual positioning of the heart relative to the chest wall. TEE, transoesophageal echocardiography. Indications. Reserved for cases where TTE provides inadequate information. Used for complex valvular disease, prosthetic heart valve assessment, and endocarditis. Common in perioperative settings, especially in cardiac surgeries for detailed imaging of the heart and aorta. Benefits. Provides higher resolution images of the heart due to closer positioning of the probe to cardiac structures. Offers enhanced visualization of the left atrium, the left atrial appendage, and thoracic aorta, ideal for evaluating complex anatomy and small structures. Limitations. Semi-invasive procedure requiring sedation or anesthesia with a risk of complications like injury. Not suitable for patients with esophageal abnormalities such as strictures. Chest echocardiography. Indications. Used for patients with suspected coronary artery disease and for risk stratification in known CAD. Accesses myocardial viability and evaluates exercise tolerance. Benefits. Provides dynamic information on cardiac function under stress, valuable for diagnosing eczema. Preferred over other stress tests due to lack of ionizing radiation and ability to access valvular functions during stress. Limitations. Challenging for patients who cannot exercise adequately, often requiring pharmacologic stress agents. Image quality can be limited, especially in patients with poor acoustic windows. 3D echo, also known as 3D-dimensional echocardiography. Indications. Used for preoperative planning, complex congenital heart disease, and valvular pathology. Provides a detailed visualization of cardiac anatomy and function. Benefits. Volumetric data enhances precision in measuring valvular structures, ejection fraction, and cardiac chamber volumes, which is crucial for surgical and interventional planning. allows a more comprehensive evaluation of heart morphology compared to 2D methods. Limitations: lower temporal resolutions than 2D echocardiography, affecting the quality of dynamic images. Requires advanced technology and expertise, making it more expensive and less widely accessible.
CT angiography. CT angiography has revolutionized vascular imaging by providing detailed visualization of blood vessels throughout the body using computed tomography technology, combined with intravenous contrast medium. This non-invasive imaging modality has become an essential diagnostic tool in modern medicine, offering three-dimensional vascular imaging with exceptional detail. CTA is commonly used in various anatomical regions such as coronary, aorta, cerebral, and pulmonary. Firstly, we have coronary CT angiogram. Coronary CT angiography is a non-invasive imaging technique used to evaluate coronary artery disease in patients with chest pain and atypical symptoms. It provides high sensitivity and specificity for detecting significant artery stenosis and plaque. Secondly, we have CT angiography of the aorta. CT angiography of the aorta is the gold standard for evaluating aortic aneurysms, dissections, and traumatic aortic injuries. CT pulmonary angiography. CT pulmonary angiography is commonly used to diagnose pulmonary embolisms in patients with acute dyspnea, chest pain, or related symptoms. Lastly, we have CT angiography of the cerebral vessels. CT angiography of the cerebrovascular vessels is used in acute stroke to identify occlusions, aneurysms, arteriovenous malfunctions, and other cerebrovascular conditions. However, it requires radiation exposure and requires contrast, which poses risks similar to other CTA techniques.
MRI angiography. MRI angiography is a non-invasive imaging method using magnetic fields and radio waves to create detailed blood vessel images, often used to diagnose cardiovascular disease without catheter insertion. It serves as an alternative and complement to other cardiovascular imaging techniques. Indications. MRI is commonly used to diagnose and assess various cardiovascular conditions including arterial aneurysms, arteriovenous malformations, aortic dissection, stroke, carotid artery disease, peripheral artery disease, renal artery stenosis, and coronary artery disease. Benefits. It is non-invasive, no catheter insertion, reducing infection and injury risks. It is radiation-free and uses magnetic fields, making it safer for frequent imaging, especially for vulnerable patients. High-resolution images. It detects issues like aneurysms or blockages early. Versatile. Effective for examining blood vessels in the brain, heart, kidneys, and limbs. Contrast flexibility. Uses gadolinium-based agents which are safer than iodine, which is an option for contrast-free imaging for those with kidney issues. Limitations. Claustrophobia. The confined MRI space can cause discomfort, sometimes needing the sedation of patients. Metal implants. Unsuitable for patients with pacemakers, cochlear implants, or certain surgical clips due to magnetic interference. Motion sensitivity. Patient movement can blur images, requiring stillness. Longer scans. MRI takes longer than other methods, which may be uncomfortable. Cost. It is more expensive than alternatives like ultrasound or CT angiography. Contrast risk. Contrast agents, when needed, may pose risks for kidney patients.
Cardiac catheterization. Cardiac catheterization is an invasive diagnostic and therapeutic procedure essential in managing various cardiovascular diseases. During cardiac catheterization, a catheter is inserted through a blood vessel and guided to the heart to provide real-time visualization of the coronary arteries, heart chambers and valves, and to measure pressures and oxygen levels within the heart. The primary objective is to diagnose cardiovascular diseases accurately and perform necessary interventions if needed. Indications: cardiac catheterization indicates a range of cardiovascular conditions. It is mostly used in diagnosing coronary artery disease. Catheterization helps in visualizing coronary arteries and assessing blockages, assessing heart valve disease. Valvular abnormalities like stenosis or regurgitation are examined to determine severity and guide treatment options. Evaluating heart failure. By measuring intracardiac pressures and blood flow, catheterization allows in understanding the underlying causes of heart failure. Congenital heart disease. For structural heart defects, catheterization provides information critical for treatment planning, especially in pediatric and adult congenital heart patients. Benefits: cardiac catheterization offers several key advantages in the diagnosis and treatment of cardiovascular diseases. High diagnostic accuracy. This technique provides a precise assessment of coronary arteries, heart chambers, and valves, offering direct visual confirmation of CVD. Therapeutic intervention. Cardiac catheterization allows for therapeutic interventions, including percutaneous coronary intervention, to open narrowed arteries, which can relieve symptoms like angina and improve blood flow to the heart. Guidance for surgical planning. Information obtained through catheterization assists in planning cardiac surgeries by providing detailed anatomy and hemodynamic data. Immediate feedback. Physicians can obtain real-time information about heart function and blood flow dynamics, allowing for immediate clinical decision-making. Limitations. Despite its significant benefits, cardiac catheterization also has limitations. Invasiveness and risk. Being an invasive procedure, it poses risks such as bleeding, infection, arrhythmias, and in rare cases, stroke or heart attack. There is also radiation exposure, which is a concern, particularly for younger patients. Limited application for certain patients. For patients with chronic kidney disease, the use of contrast agents during the procedure poses risk of nephrotoxicity, making it a less favorable diagnostic option in such cases. Expense and complexity. Cardiac catheterization requires specialized equipment and trained personnel, contributing to higher cost and limited accessibility in some healthcare settings.
In summary, advanced imaging techniques play a crucial role in diagnosing and managing cardiovascular diseases, each offering unique benefits tailored to specific clinical needs. Echocardiography provides detailed visualization of cardiac structures, while CT angiography and MRI angiography enable precise, non-invasive imaging of blood vessels. Cardiac catheterization, though invasive, remains essential for real-time assessment and intervention in critical cases. Together, these imaging modalities allow healthcare providers to make informed decisions, leading to improved outcomes for patients with cardiovascular conditions. Thank you for your attention, and we do hope this overview has highlighted the vital contributions of cardiac imaging in modern medicine.